right, welcome back.
Hey, Rick.
Here we are, Healthier Ever After. We're excited. We got this episode, and I think another one. We're going to talk about some stuff that I think is needs to be addressed. We give advice and information and education here. We are not your medical provider, so please don't take this as a personal medical relationship. We encourage you to seek care and information and advice from your personal primary care provider, medical provider, before starting any weight loss program, medication, exercise regimen, or whatever the case may be. Now, we would like to give some helpful information, and so let's get into it. We want to talk today a little bit about the stigma around obesity.
Yeah.
Like our whole thing is about losing weight and maintaining health, and that starts with being obese and not being obese. We want to move that direction. But there's big stigma. So interestingly, I think we want to talk about this. There's a big article and a policy statement on 3 leading obesity organizations gave new guidance. This is just last month, March of 2026.
These are the organizations that we use as providers to get kind of our general outline. It's like the American Cardiology Association or the American Diabetes Association or Endocrinology Association. These are the main bodies that give us the
generate and analyze evidence and give recommendations based on what is helpful. So one of the things that we're gonna get, I think we'll get into a whole episode on just that article. I guess it is really game changing on how that the recommendations are so different now recently with the advent of some of these medications we've been talking about. But today we want to talk a little bit about one of the problems. It says let's see, one of the problems with obesity, being overweight, whatever term, we're not here to discriminate, because that's what we want to talk about. It says obesity stigma has long been a problem. This article says more than 40% of people with class 2 obesity, that's a basic mobility, or a BMI of greater than 35, report discrimination due to their weight. So that's one of the key things that some of these recommendations talk about. We just want to talk about that a little bit, why is that a barrier, and what we can do to overcome that. And that's just not as a you thing. This is us as medical providers. This is your primary care provider. There are people that need to know and change their practice because it's just a thing.
Yeah, it is. And I think going into this, maybe this episode and maybe even next one, because we're looking at talking about this stuff, and some of the topics we'll discuss are a little bit controversial, and these are not meant, these are more information driven. They're more us speaking out loud as medical providers and as people that have dealt with probably some of the stigma coming our direction as well, as people that have been overweight and still are always going through this process of being better and being well. We never, when you listen to this, we might say a word wrong here or something wrong there. Don't take it as anything other than we're just trying to generate a conversation, and hopefully you hear us and know that we are on your side. And this isn't us pointing the finger and saying you're bad, we're good, or anything like that. It's really more so about, if you're listening to this, you've probably thought one way or another about these things, and we're just trying to bring it to light and have a discussion about it.
Yeah, no, it's good. And so this discussion kind of comes from an article that was cited by these organizations. This is a 2022 article by lead author was Adrian Brown, a couple other authors on that. This is in excuse me, a Journal of Medicine, eClinical Medicine. So this is May 2022. So this is a few years old, but this talks about, it's a review they did on the pervasiveness, impact, and implications of weight stigma. And just, I want to read a little bit of the summary on that. It says evidence has accumulated to demonstrate the pervasiveness, impact, and implications of weight stigma. As such, there is a need for concerted efforts to address weight stigma and discrimination that is evident within policy, healthcare, media, workplaces, and education. The continuation of weight stigma, which is known to have a negative impact on mental and physical health, threatens the societal values of equality, diversity, and inclusion. And then it goes on to talk about some of their suggestions and things. But by weight stigma, I think it was talking about like you're fat and therefore of less value or less valuable, and that affects, like they've shown, there's more evidence that affects a ton of things like mental health, physical health, but other things like education, how it's portrayed in media, your workplace. I mean, you've got some other information on that.
Even employment, dating websites, they've gathered tons of data on this because like the new age, like that's where a lot of people are meeting people. I mean, it's probably the number one way. And it's readily available data. Yes. And so they pull that data and they're finding that there's just a significant bias against people that are overweight or obese. And the answer before, and I think that what we're going to talk about more a little bit, but the answer before was, well, everyone should just accept and be just accept people for their size and that. The shift, and this is once again lack of a better way to maybe say this, is no, let's like address the issue. Does not mean everyone has to be the same size and all that. What it's saying is that, like, why are we trying to just ignore the fact that the obesity has a lot of really good health reasons, but also social and economic reasons that why, losing weight and also feeling healthier and being healthier are really good things. Yeah.
Well, I think part of the stigma that they're talking about, it comes from, a perception that first, I think it starts with the belief that obesity is the result of a behavioral problem or a personality flaw. And really, we'll get into this other guidelines in the next episode, I think. But we talk about how really obesity needs to be treated as any chronic medical condition. Yeah. And so by saying, hey, you're overweight, your basic, like I say, your BMI is 40, that's a lot of overweightness. That's like me saying your blood pressure is high, your cholesterol is high. Your blood sugar is high. Yeah. Like there's medically, there's something going on in your body that is going to reduce your health and longevity and life and lifestyle. Like it is. So we need to treat that as any of these other chronic medical conditions, and not in a judgment type of a way. Not like this is bad. It's just you have this disease.
If we dance around the problem, then we just really end up where we started. We put a lot of effort into dancing around a problem and not really addressing it. There are things like when your blood pressure is just a little bit high and your first visit to your primary care, maybe they will say, hey, let's try lifestyle changes and check back in 3 months and see how you're doing. Just like if you were a little bit overweight. But once you get to that point where it's going to be a detriment to your health long-term, if we don't do something about this, we need to, rather than just saying accepting someone for how big they are, you can accept them while still caring about them enough as their medical provider, as their family member, or even as yourself, just wanting to show yourself some love by saying, hey, look, I know that this is going to have long-term health implications. It may affect future, and we'll talk about some of these stats, future job opportunities, things like that. Now, we're not here to say right or wrong, right? Like, it's wrong when people judge people based on a size or a weight or a color, a race, or anything like that. That's a wrong thing, right? We acknowledge that that's not okay. But what we're saying is that, like, okay, can we do something about that? Can we help patients, like, lose some of that weight and feel better, and not necessarily fit into a size 2, because that's not always the goal, right? The goal is to get you in a good place. And so hopefully we can dance around this without, once again, offending people. More so just let's provide information about these stigmas, why they're there, and it happens in really all areas of our life.
Yeah. So I'm just trying to, I guess, glean out how we're going to talk about in just a few minutes, but what do we do about that? What the effects of that are? So the effects of when we talk about weight stigma, it's negative attitudes. What is it, right? It's negative attitudes, it's beliefs, it's discrimination based on body weight. It includes bias, stereotyping, social exclusion, unequal treatment, and it's directed towards people living with obesity. All right. So why does it matter? Key impacts. It number one, it affects mental health. it leads to increased depression, anxiety, low self-esteem. And that's why it can explain in large portion the link between obesity and poor psychological health. A lot of it is we put that on people, right?
So what it was it? I found it on here, psychological depression risk, 1.5 to 2 times higher likelihood of depression. I mean, you are doubling, if not, you're doubling your risk of depression by simply being overweight. And once again,
but I think one of the points that they're making too is it's not just by being overweight you're doubling depression. It's how we treat you because you're overweight.
100%. Yeah, and of course I'm going to fumble all over my words here. So the truth is that yes, it's the rooster or the egg, right? You're trying to figure out, like,
roosters don't lay eggs.
Oh, rooster, chickens. I meant chickens. Hens. Okay, no, listen to me.
We are medical professionals.
It is chicken or the egg. What I was getting at is, like, okay, so we can argue why it happens and what happened first, like, but it's like the under treatment even of someone that goes into a medical office. I mean, this is our realm. This is what we do. And the medical treatment, if they don't go into an obesity clinic, a weight loss clinic, I mean, the under treatment of people is significantly higher than had they gone in and they were of a lower weight. It almost seems opposite of what you'd expect.
69% of doctors report in one study report weight bias. Yeah. And I mean, you're exactly what you're talking about. It leads to less time spent with patients, less empathy and education, reduced trust from patients, and delayed care.
Yeah.
For all care, So I mean, that's a real thing, and that's troubling when your clinicians have this perception and treat people differently because of their weight.
It's for example, if someone comes into the clinic, and this has not happened in clinic, I'm just trying to illustrate this from a medical side. Let's say that a patient comes in and they're 100 pounds overweight, and they come into the clinic and they say they have knee pain. Yeah. Well, immediately the medical provider may assume it's automatically due to their weight. So they say, well, yeah, you have knee pain, you should lose some weight. Or maybe they don't even tell them they need to lose weight. They just assume, and they're like, oh yeah, give it a couple of weeks. It's probably just some inflammation. It'll go away. Whereas someone of a normal BMI comes in and they say they have knee pain. Well, now they don't have that crutch to lean on and say, oh, it's your weight. So they might have to look into this a little bit more. The patient might feel more heard. Maybe it is partly due to their weight. Does it really matter? Like, should they be treated any different?
No, they shouldn't be treated any differently. I think you do the same things. However, contrary to that, like as a provider, I think I talked about this before, but so coming with knee pain and you weigh 350 pounds.
Yeah.
Granted, I would be wrong to say, there's nothing else wrong with your knee but your weight. However, I feel like I'm doing a disservice if we don't address that. If you come in and say, hey, your kidney function looks like it's decreasing, like we did some basic lab work this year, and compared to last year, your kidney function is down. We want to keep your kidneys healthy. We need to address your blood pressure, right? So I think the same thing, like say, hey, your knee hurts. We need to look and things, but there's also this other thing that may be helping or contributing to that. We ought to address together, but address it not as you need to do better in life, as opposed to I need to help you come up with a strategy and a treatment plan for this chronic medical condition.
I think if patients felt that their provider was offering solutions and help with, hey, yeah, you have knee pain, maybe your weight is a contributing factor, maybe it's not, but most likely if you're overweight, it could be a contributing factor. We know that eventually, at least if it's not now, it will be later on. And then with a team approach, say, not how are you going to fix this? You eat less, but how are we going to fix this? How are we going to work together as a team to be able to fix this? Because that's really what your primary care provider is really a part of your healthcare team.
Yeah.
So I think if there was less of kind of like, I feel like the finger's being pointed at me, and more of like, hey, let's look at the knee, let's do x-rays or whatever it is that you guys feel like is going to be best at that visit. But also, hey, let's maybe address some of these contributing causes. Maybe you shouldn't play so hard at church ball. Maybe you need to take it easy. Or maybe it is that you have that excess weight and you do play basketball 3 times a week and it's just wearing that dang knee down. So I really think that I think that with the stigma, I think rather than avoiding it and then treating patients differently, I think it's like, hey, let's address this as a possible, at least part causation of this, and let's like attack this together. Let's fix your knee or get it in a better spot, but also like let's help
address
some of the
this chronic thing.
Sure.
Okay, so other effects, back to what, why this matters, behavioral effects. So this is interesting, that the weight stigma, the meaning what we put on people for being overweight, our perception of them, the stress that they feel from that, the ostracized feeling that they may get, that leads to increased calorie intake, increased emotional and binge eating, decreased physical activity, and decreased healthcare engagement. I don't want to go to the doctor. He's just gonna tell me I'm fat.
I had this today in clinic.
Like you did. You were
in clinic
today.
I had a gentleman that said he doesn't like to go to the doctor because he doesn't want to be told that he's fat. Again, he doesn't like to go in because, so then he came into me, of course, I run a weight loss clinic. And so he came in, expecting to try to address this, but he doesn't like to go in. He said it raises his blood pressure, and then they're on him about that. And he's like, I don't normally have high blood pressure, but it just stresses me out to come in and be told that really with no solutions. And so that's a very frustrating thing.
Yeah. And I think that's you just said the key thing. I think. I mean, and anyway, what that leads to, people don't engage their healthcare provider. They avoid going to the doctor. And so there's these health problems build up that they don't address, and they're depressed more, and so they eat more, and it's just so counterproductive.
Can I add to that?
Yeah.
Also, and I don't want to cut off your thought there. I know you're going to say something.
I'll get back to where we're going.
Well, all I was going to say is that adding to that is what I see anecdotally in clinic all the time, and I think you'd agree with this, is that I see people that say, look, I had this 25th high school reunion coming up, and I didn't go. I found an excuse not to go because I was so embarrassed about the way I look. So think about that as like a person that would actually otherwise look forward to going to that high school reunion and catching up with old friends and just seeing where everyone has kind of ended up. And imagine being the only reason that you didn't go to that is because, and some of you probably are listening to this right now going, boy, that was me, or that is me. Imagine the fact that when you socially isolate yourself like that, you will have more depression, right? You will have
based only on your perception of your appearance.
And so maybe your old high school friends would care or wouldn't care. That's not the point. The point is that you care and you feel that stigma or that pressure to be a certain size or weight. And the problem is that like to ignore that and to say that this is only a physical problem is ignoring half of the problem. Yeah. So sorry.
I lost my thought now.
Oh, I knew it. I see. I cut you off, and I knew
it's all good. No, it's all good. We were talking about like the spiral that does. But transitioning for that. So I think one of the things that we have to be cautious. This is really hard to talk about sometimes because we don't want to sit there and just say, hey, you're big, you're heavy, you're fat, you're whatever. Like those are, and a lot of those terms are kind of diminutive, and that's what we need to avoid. Now, but on the other hand, this is not like there's a lot of I've heard people say, well, this such and such overweight person, they just want me to view them like they're normal or they're regular or they weigh the same or it doesn't matter or whatever. And I get that, like we ought to treat everyone the same as people, not treat anyone less because they're overweight. We don't do the same thing. You can't see people's blood pressure. That's the easiest comparison, right? People got high blood pressure. You treat it like a medical condition, right? You need to treat this. But at the same time, we don't want to say it's okay to be overweight. Because from a health, not from a what type of person you are or what you're doing right or wrong, but this is just an issue of being overweight brings so much other downside to your health. And so at the same time of not saying it's okay to just be overweight, we just recognize it, I guess, I think what they're recommending on this is we need to get rid of the stigma and recognize that as a chronic medical condition that is multifactorial. I want to get into that a little bit as well. But rather than, you do life wrong, therefore you're overweight, that's not how we need to treat this. So it's kind of this balance, like it's not okay to be overweight, not because you're doing something wrong, but because it's going to make your life shorter and more miserable. And that's what we want to try to avoid. We want to make it better and longer.
And your weight is so, and what he's saying, and I think Rick said it earlier, is that your weight is not a personality flaw, but it's often like we either view that about ourselves, or maybe even people do view that about us if we have some extra weight. But also the answer, and what this is saying is that, like, for the longest time it was, you're overweight, but because we don't want to either make you feel bad, or because maybe as a provider I don't want to have to deal with that uncomfortable conversation, it sometimes gets glossed over. Hey, you need to lose some weight, and then they move on. And what they're saying is like, no, this needs to be treated like any other disease. We need to address the issue. Why we can't just ignore this. Even if, like, even just saying, hey, you did life wrong, like as you were saying earlier, like that's ignoring it, because you're actually not offering solutions. You're just saying,
well, that's what I was going to ask you.
Yes.
So you have people come into the clinic, right? And they feel frustration that, like, man, I go to the doctor and I just told him overweight and I need to, eat less and move more. And do you think some of the frustration that people feel like as a patient, like I just don't like going to the doctor because they just tell me I'm fat. Is that, do you feel like, in your experience, maybe, is that because there's a recognition that you are overweight, right? But there is a lack of real achievable solutions or care, or like there's not a path laid out. It's like, you need to fix that.
I think and me and Rick have been in medicine for a while. Rick longer than me. I'm not trying to say he's old, but he ain't young. I think really what
I'm really interested in the longevity thing, because it's getting closer and closer to that.
I know we need to, like, extend that life out a little bit. All I'm saying is that we've both been in medicine long enough to know that, like, it's almost like telling a patient that they're overweight is almost where that ends. Like, almost like we've been around long enough to where it's like, hey, you need to let your patient know that their BMI is elevated. And then it's like, end of discussion.
Yeah.
And we're just proposing, as well as the stigma and these articles that we like to reference to, we're just proposing that it shouldn't stop there. It should be, you're overweight. What can we do? How can we support you? If that's medications, great. If it's just lifestyles, and people do and can be successful with just lifestyles. Now, we know that's only 5% or a 5% reduction compared to 25% with medications, and it's specifically GLP-1s. But the point is there still is a number of people that, through lifestyle changes, but if your provider or whoever's counseling you on this doesn't have good solutions for this, then a lot of times it's like, now all you do is get told I'm overweight with no solutions. So once again, who's going to really want to go back to their doctor's office and say, hey, I have stomach pain? And they always bring it back to, it's probably overweight.
This article that we've been talking about mentions that a little bit, kind of how you describe that. What they said is that there's the dominant narrative that we've all been taught or had or exists currently is they summarized it as, weight is fully under personal control. So your weight is 100% the result of your behavior, right? And so what that does is it ignores the evidence that shows that obesity is complex, multifactorial, it's biologic, it's genetic, it's environmental, it's determined by social factors. And so the misconception, this is under your full control, you just need to fix it, right? That drives health policy issues and care that you get at the position. There's blame-based policies, there's stigmatizing messages, just eat less, move more. Those are things that perpetuate this idea that this is just something that you have done. And we would never do that with another medical condition, another problem. We would say, oh, your blood pressure is high. You need to fix that.
I think you pointed out the thing that is the biggest thing that's the difference between obesity and your blood pressure or blood sugar or cholesterol. I think you pointed it out earlier, and I haven't actually thought about it like this, but it really did kind of like light bulb. It's one of the only conditions that you can look at someone and tell they have immediately.
Right.
And now you need no other information, right? As their medical provider or as a person walking down the street, you immediately make assumptions based on that. And that can be good or bad. That can be, we all have biases. And so I think that this is getting at is like, why not address this issue as opposed to just ignore it?
Well, it's compounded. Like, for example, by media.
Yeah.
Let's just, I mean, it's, go that the media's role frequently portrayed. I mean, how is an obese person portrayed in the media?
Yeah.
Frequently as lazy or undisciplined, and that perpetuates this narrative. So what does that do to anyone? I mean, that just means this thing that I can see your medical issue.
Yeah.
You're overweight. And I just have that message from media, like that, you're overweight, and that means you're lazy and you're undisciplined, and therefore I'm not going to hire you, or I'm not going to date you, or I'm not going to, whatever that may be. It's this cycle.
It makes you wonder, when you're talking about that, it kind of made me think, I'm like, it makes you wonder what if we had like our blood pressure always on our forehead? Like, what if it was like always printed on our forehead? Like, can you imagine, like, sometimes you'd look at people and be like, dude,
your cholesterol,
yeah, like your LDL is printed here, your blood pressure's here, and you're like,
wow, dude, what did you eat for lunch?
Set down the donut. It's the truth is that when it comes to obesity, that's what it is, and no one else has that. And
it's like the scarlet letter.
It is,
and we treat it that way.
We 100% do. So how do we as medical providers, this is what that's trying to address, is how do we address that as medical providers? How do we address that as human beings? And part of that answer, not the full answer, but part of that answer is to address obesity, right? Is not to view it as something that is inchangeable.
Address it as the chronic disease that it is.
Yes. And when we work on your blood pressure, and when we work on your blood sugar and everything else that we might be able to find on a lab test somewhere that's not advertised to the public, we also need to treat obesity like that. And it is multifactorial. I've had patients that can change lifestyle and get their blood pressure under control. And I've had others that no matter what they do, they can work out 3 times a day and eat all the good things. And even just because of genetics and just life factors, they can't get their blood pressure under control without medication. So obesity is the same thing. Everyone's going to require a little bit different answer. And that's going to be very complex and multifactorial, as it said.
Well, and so going on to some key recommendations, then we don't run all night, but some of the key recommendations: number 1, change the narrative. So we need to change the narrative, treat obesity as a chronic, complex disease, shift our talk, how we treat this from a weight centric to a health centric, right? Obesity is not just you're big. You have a stronger relationship with gravity than I do. I think you see how you put that, but it's a health centric. And that's what we're talking about, is like all the things that come with that. And so we want to improve health. And so we change that narrative a little bit. We avoid stigmatizing terms like morbidly obese and obese, and like, I don't know what else we say as in the medical field. I mean, those are literal things, but you don't want to say, hey, you're fat, you're, whatever. And then they talk about healthcare reform, train providers. I mean, this is, this is a big policy. This isn't something that anyone listening to this really is going to do, but their recommendation, we need to talk to medical providers. We need to train in medical schools how to recognize and reduce this bias, how to create weight inclusive environments, and address social determinants of health. So there's a whole lot of things, media reform, use accurate, non-stigmatizing portrayal. I mean, there's a whole lot of things we can talk about that we go into that, but really in the short version, I think I would just say it's treat people like people, and treat obesity like any other disease.
Can you imagine how ironic all of this is, that we treat the people that probably need the most attention and the most care, the healthcare system that's supposed to be helping them alienates them. The people that are supposed to be helping them push them to the side because of a condition that they actually should get more help, more care, feel more comfortable in that environment, because that's where they're getting their problem addressed. Instead, it's met with a stigma that actually force is a strong word, but promotes them to really not be able to or feel comfortable going into that environment. And so it's not saying ignore it. It's not saying, hey, yes, we should just make bigger clothes and promote obesity, because there is kind of a thing that a shift in society that seemed to go that way for a little while. It's actually saying, let's talk about it and address it. Let's not shame people. Let's address it.
I mean, I got nothing else to add to that. It's,
Yeah.
what we gotta do.
Okay, that's what I got to do.
I think
Yeah.
that's good. Yeah. So I mean, this I guess this is a little different off the normal path or thing, but it's an important thing to address and be aware of. And if you're in any of these situations, really, we want you to be able to have a relationship with your healthcare provider. We're actually working on some things to try and provide some education to medical providers.
Yeah.
To do this very thing, to kind of change this narrative, change how we view and how we treat obesity or overweightness,
Yeah.
or whatever we're going to change that narrative to. But so that we can treat this like any other disease and treat people of all shapes and sizes the same and equally, and get them the help that they need and the health that they need.
Absolutely.
So
I think that's great. Yeah, I think once again, take this for what it's worth. We're going to talk about all subjects, and sometimes they're going to be a little bit touchy, but they should be. This is kind of a touchy subject, and so take it for what it's worth. We're here to help. We're trying to provide good information. Hopefully, you can find a good health care provider in your area that you can trust and that is moving towards really just trying to help. And
help and address this as what it is.
Yeah.
All right. Best of luck, and we hope that you can get to that point where you are healthier ever after.